there, my name is Dr. Mad. I'm gonna go ahead and do your medical examination today. So I'm the resident on guard for tonight, and I'm supposed to do a cranial nerve exam and make sure that I get all the right responses from you, and I will go and give this information to the attending to make sure that we're giving you the proper care today. Okay? Can you please verify your first and last name and your date of birth? Perfect. And do you have any allergies? Great. Any medical history that I should be aware of? Vertigo, okay. Have you been experiencing any headaches, any blurry vision, anything abnormal? Headaches, okay. And have you noticed that your eyes are moving kind of rapidly sometimes? You haven't. Okay, that's a good sign. And are you taking any medications? Lexapro, good. And how many milligrams of that? 15 milligrams. Okay. All right, so what I'm going to do today is I will do a full body cranial nerve examination, make sure that all 12 cranial nerves are intact. I'm going to touch your face, your head, your neck, your arms, and your legs. Is that okay? Great. So I do have consent. Let's go ahead and start with vital signs. I'm going to go ahead and put this on your arm. And is it okay if I put this on your chest? Thank you. All right, I'm going to have you uncross your legs. And please breathe normal. Okay, blood pressure is perfect. It's 118/74. Okay, let's go ahead and take your oxygenation. This will go on your index finger. Go ahead and extend that for me, please. Thank you. And again, you can breathe normal, please. Okay. Heart rate is 73 beats per minute. Oxygenation is 99 percentile in room air. That's great. Any flu-like symptoms in the last 48 hours? No? All right, I'm going to go ahead and take your temperature. Please relax. Okay, 99.3. That's perfect. Okay, I'm going to start by examining your reflexes. I'm going to ask you to relax your jaw for me, please, okay? I'm going to slowly tap on your jaw. Relax a little bit more. Just like this. Good. Okay, perfect. And now I'm going to go ahead and tap on your bony prominences. On the shoulder. Good. On your wrist. Okay, perfect. And on the other side. And on your other shoulder. Okay, perfect. Let's go ahead and check your legs as well. so I'm going to just slowly palpate. Any pain, any discomfort? Okay, good. Okay, can you please pull your feet towards you? Good. And now pull the feet towards me. That's good. Lift one foot up. Good. And now the other one. Perfect. Okay, I'm going to check your Babinski reflex. Now I'm going to slide this hammer across your legs and then towards your big toe. I'm going to try to make it as painless as possible. Okay, and on the other side. Okay, perfect. Is it okay if I sit down next to you? Thank you. All right, what I'm gonna do now is I will check your vision. Have you noticed any floaters, anything abnormal, like a rhythmic reaction of your eyes? No. Does the light bother you at all? No. All right, so what I'm gonna do is I'll have you look straight at my nose and I'll shine a bright light in your eyes. Good. Good. Can you please look up for me? Good. And again, look up. Good. Can you please follow the light with your eyes only? Don't move your head. Okay. Now I'm going to have you cover one eye. Very good. Thank you. Okay, so can you please tell me when you see my fingers in your field of vision? Now, good. Now, good. Now, perfect. Perfect. Okay, let's go ahead and switch eyes whenever you're ready. Perfect. Thank you so much. Okay, go ahead and keep on looking straight at my nose and tell me when you see my fingers in your field of vision. Now, good. Now, good. Now, perfect. Now, wonderful. Thank you. Go ahead and uncover your eyes now. Thank you so much. So go ahead and look at my finger. Follow my finger with your eyes only. That's good. Great. And now I'm going to go ahead and approach the finger very close to your nose. I need you to keep on focusing on my finger, please. Good. Perfect. Okay. Now I'm going to check your extraocular movement. So go ahead and please focus on the light right here. Perfect. Keep on focusing on the light. And can you please tell me when you see a new object in your field of vision? Now, good. Keep on focusing on the light again. Good. Look at the light. And tell me when you see a new object in your field of vision. Now, okay. That was kind of a delayed response there. All right, let's go ahead and check your ocular nerve. So for that, I'm going to have you look straight forward, straight behind me at the wall. You can focus on the TV if you want to. I'm going to come very close to your eye and take a look inside and make sure that I'm checking your retina. Okay? Okay. Keep on looking straight behind. Retina is intact. I'm not noticing any abnormalities. No scratches. That's good. Okay, let's go ahead and check your other eye now. So I'll have you do the same thing. Good. Okay. try to keep your eyes open for me, please. Perfect. Okay, wonderful. What I'm going to do now is I'll do one more test. I'm going to need you to tell me which fingers are moving. So I'm going to lift up my right fingers, okay, and my left fingers. So go ahead and tell me if it's right or left whenever you see them moving, okay? Good. 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 Left. Right. Both. Right. Both. Good. Good. Perfect. Wonderful. Okay, I'm gonna go ahead and check your facial sensations now. And what I'm gonna do is I'll test you for sharp and dull sensations. This is what dull will feel like. Perfect. And this is what sharp will feel like. Excellent. Now, have you noticed anything abnormal? Any twitching around the mouth or the eyes? Okay, perfect. So this should be pretty relatively easy. I'm going to ask you to close your eyes whenever you're ready. And I'm going to ask you to tell me if you feel sharp or dull. Dull. Good. What about now? Sharp. Perfect. What about now? Dull. And now? Dull. Good. What about now? Sharp. Good. What about now? Dull. And here? Dull. And now? Good. What about now? Sharp. And here? Sharp. And here? Sharp. Great. Okay, go ahead and uncover your eyes. And in fact, let's go ahead and try one more test. So go ahead and cover your eyes again. And I'm going to ask you to tell me if you feel dull or cold. So this is what dull is going to feel like. And this is what cold is going to feel like. Okay, let me go ahead and show you that one more time. Okay, perfect. Okay, so go ahead and tell me if it's dull or cold. Cold. Dull. Cold. 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 Dull. Cold. Cold. Dull. Cold. Perfect. Go ahead and cover your eyes. Excellent. Okay. I'm going to check your hearing now. What I'm going to do is I'll whisper some numbers in your ear. Can you please repeat them back to me? 84, perfect. 79. 43. Good. 45, perfect. Okay, so what I'm gonna do now is I will do a test with a tuning fork. I will strike it and put it right here underneath your ear. I'm gonna need you to tell me when you don't hear that sound anymore, okay? Now, perfect. And on the other side. Now, okay, perfect. Is it okay if I check your ear canal? I'm going to check you for any fluid, any cerebrospinal fluid discharge, which would be really an abnormal finding during a cranial nerve examination. Is that okay? All right. So I'm going to have you look that way for me. Okay. So far, everything looks good. No signs of infection, and I'm not seeing any cerebrospinal fluid behind that eardrum. All right, I'm going to have you look the other way now. Okay. This ear looks intact as well. I'm not seeing any extra fluid, just a normal amount of earwax, and no signs of inflammation either. Perfect. Okay. I'm gonna go ahead and check your taste. Have you noticed anything abnormal? Do you mind giving me a big ah before we do the taste exam? Good. Good. Can you please move your tongue up and down for me? Good. And now side to side. Excellent. All right. I'm going to put one drop on your tongue, and I'm going to ask you to identify this taste, okay? Tastes like chocolate. Perfect. All right, let's go ahead and check your nose. Can you please look up for me? Okay. Thank you. All right, no obstruction there. Keep on looking up. Good. No obstruction, no signs of inflammation. Perfect. All right, let's go ahead and check your smell. All right, so before I check your smell, can you please cover one nostril and take a deep breath in and breathe out? Good. Okay, perfect. Go ahead and do the same thing on the other side. Breathe in and breathe out. Perfect. All right, so both nares are patent, which is a good sign. Now I'm going to ask you to close your eyes again. Go ahead and close your eyes. Thank you. And can you please take a deep breath in through your nose and make sure that you identify the smell really good. Excellent. All right, so can you please tell me what this smells like? Lavender. Excellent. All right, I do have one more. This is one of my favorites. Perfect. Thank you. And go ahead and take a deep breath in and breathe out. Wonderful. So can you identify that smell? Mint. Perfect. Okay. I'm going to go ahead and check your heart and your lungs before I leave. Make sure that there's nothing else that I'm missing. Is it okay if I slide the stethoscope underneath your shirt? Okay, thank you. Go ahead and relax for me, please. You don't have to take a deep breath in. I'm just checking your heart, making sure that I'm hearing all the right sounds. Good. Now go ahead and take a deep breath in and breathe out. Good. One more time. Take a deep breath in and exhale. Excellent. Okay. Okay. And is it okay if I check your abdomen as well? I'm going to slip my hands under the cover. Let me know if you feel any kind of pain. Okay, I'm gonna go ahead and check your groin for any lymph node enlargement. Good. Perfect. Okay. Okay, so it looks to me like everything is within normal limits. I could not find any abnormalities. Your all 12 cranial nerves are intact. That's a very good indication that you might be discharged soon. I'm going to send all these results to our attending on charge tonight, and she's gonna go ahead and come back with any further instructions about your care. Do you have any questions for me before I leave? Okay, perfect. Well, thank you so much for your cooperation today. It was a pleasure to meet you. If you have any other questions, you can go ahead and tell your nurse, okay? All right. Good night.